Hello, my name is Michael Collins. I work with TravelMedia.ie. Today I'm talking to Dr. Graham Fry of TMB in Ireland and Nomad Travel in the UK and also Trinity College Dublin. Dr. Fry, you've noticed a issue with the PCR test, specifically when it comes to the second test. And a lot of people are getting second tests now, having had COVID a number of weeks and months ago, and they're getting those tests because they either need to travel or they need to get back to work. Can you talk to us through the issue that you've identified?
Okay, the biggest problem is somebody who's had COVID, they typically will have had that diagnosed through the PCR swab we've all seen on television over the past months. And that PCR swab is very good, but it's very sensitive. Once you've had COVID, if you repeat a swab 1, 2, 3, 4 weeks later, you're very likely still to find the genetic material within the nasal cavity. And the difficulty here is that many places are looking for a clear swab before they let somebody go back to work, before they let somebody travel, etc. And that is very hard to achieve because after, as I said, after you've had COVID, it's going to remain positive for a significant period of time.
So the issue is that when people get a certificate having had a COVID test via the PCR method, what they're seeing is either a detected or not detected result, whereas in fact, the result should be a bit more nuanced. And with the help of, let's say, a medical practitioner, they can interpret that looking at the CT rate.
Yeah, that's correct. I mean, basically, the way the reports come through at the moment is black and white. But fundamentally, do you have it or do you not have it showing? And if it is showing, it's not really whether or not it's at a high level or actual low point. It's just that it's there in the first place. And after you've had COVID, it will stay positive for a significant period. So it would be very helpful to be able to say that beyond a certain level, that it's not significant. Once somebody has had COVID, they should not be infectious 10 to 14 days in most cases following that time. So at that point, they should be allowed back to work, international travel, whatever's involved. Unfortunately, when we're relying on the PCR as being the sole way of identifying whether somebody has COVID or not, that's where it becomes very difficult.
And then talk to me about in terms of how you can actually see this. So for most uninitiated, what they see is a detected or not detected, but often a lab will produce what's called a CT rate or CT score. Talk us through the different levels and what that tells you as a medical practitioner.
Okay, the CT is an amplification process. It's basically how many cycles does the machine, the analyzer, have to run through by multiplying the sample before it can find the actual COVID. So in many ways, this is the opposite of what you might expect. I mean, generally speaking, you talk about a high result being a significant result and an actual low result being an insignificant result. This is the opposite. So if the machine only has to multiply a small number of times, that would strongly suggest that there's a lot of viral material present. If it has to multiply many, many times, that would suggest there's a very actually low amount of the virus present. And that's good, obviously, because once you've had the disease, the amount of virus within the nasal passage should drop as time passes. But of course, you have to be able to see how many multiplications were done in that particular test. And if it is an actual low figure, let's just take 20 as a figure. If it is below 20, that is a very, very significant suggestion the person has active COVID going on within their system. If that multiplication is 35, 36, 37, 38 times, that would strongly suggest that it's the end of infection. Now, there is a little caveat here. It could be the start of infection. So that's why you have to link this in with whether the patient has definitively had COVID at some point at the past.
What are you calling for? Because that information is available. A lot of labs are providing that information, but is it because there are no guidelines at a governmental level in terms of how these CT scores should be used, or what do you think will help all of us as a society move forward and allow people to get back to work?
I think it's basically because this is something new. We're still trying to learn how to deal with this situation. And so fundamentally, when it was a yes, no, black, white answer, it was very straightforward. When you get into the scenario of it's a grayness, in other words, it isn't absolutely clear, that's where it becomes very difficult for people to understand. And so I suppose what we need to move towards, because without a doubt, within Ireland, within England over the past month, we've had a colossal number of people who have presented with COVID confirmed on their PCR swab. Now, if even a small percentage of those people want to travel over the coming months, they're going to have difficulty because their CT test may actually still show there is presence of the actual virus, the genetic material of the virus within the nasal passage, even though it's of very little significance they're not infectious to other people. After about a 2-week period, in the vast majority of cases, they're not going to be infectious. So we need to move to a situation where instead of just the laboratory report detected, non-detected, we need to be able to link this to whether or not the person has definitively had COVID 2 or 3 or 4 weeks previously, and link that to the level of the report we're getting from the laboratory, and thus be able to produce a certificate which would show that the person is not infectious and should be allowed to travel.
So in many ways, the PCR test, which is the gold standard, which is the gold standard, but it's too sensitive for the way that the virus is developed and the way that we need these results to be interpreted. This obviously is a requirement that government need to move forward, or where does it come from in terms of changing the protocols or the standards when it comes to these results?
Well, that's a difficult question, because obviously it's not just a government. You need the airlines, you need governments throughout the world, immigration authorities, you need the employers to accept. There's a load of different groups that are going to be involved in this. But I think we do need to move towards a situation that if somebody has had a confirmed COVID test done 1, 2, 3, 4 weeks previously, then they should be allowed to return to work with certification. In other words, to be confirmed that they did have COVID, then they should be allowed back into work at that point, because they're not infectious to other people in the vast majority of cases.
And of course, employers want people to get back to work. And specifically, we see regular headlines in the UK and in Ireland of large numbers of key workers who are prevented from coming back to work because the current testing protocols don't permit them, because they were not looking at the CT score. So it's affecting not just travel, but also the work environment.
No, that's very, very true. And I think if we have to move forward, and if there's no doubt that this is going to become more and more of a significant problem in the months ahead.
Well, thank you for your time, Graham Fry, and hopefully governments and others will take note of this, including employers and airlines, etc., and we will see a change to the reporting of the PCR, and hopefully people will be looking at the CT score. And as you say, that has to be done in conjunction with a medical practitioner. Thanks again for your time, Dr. Fry.